Hello, everyone. Welcome to tonight's webinar. I'm so excited for you to be here. I'm Dr. Katie Woodley. I'm going to give people a moment to jump on in here, and I'm going to go ahead and share this if we can also. So just take a minute. I'd love to hear where you're joining me from tonight on our webinar, what your pets have. We've got a lot of people joining us. I'm so excited to share this topic. It's near and dear to my heart. So if you're new here, welcome. I love it. I see you in the chat there. Awesome. Tell me where you guys are joining from. What part of the world? Boston, Carolyn, Enid, I'm in LA. I love it. I love seeing where you're at. Karina, Michigan, Buffalo, New York. Karina or Carrie, I have a lot of relatives in Buffalo, New York. My mom was raised there, spent a lot of summers there as a kid. Alicia, Staten Island, Laura, Asheville, North Carolina, Naples, Haley. Hey, everyone. Sandra, Puerto Rico. I wish I was in Puerto Rico right now, Sandra. All right, give people just a minute. Keep popping that in there. I love seeing Diane, Manitoba, Patty, North Carolina. This is going to be great. And I want to hear too, are you currently having any gut health issues or what you think are gut health issues, or maybe something unrelated to possibly unrelated, let me reword that, to a gut health issue with your pets. New York City, Sherry, my dog has IBD. Yep, okay. And we're going to share a lot of information to help your pet with IBD, carry allergies. Okay, so yes. And what you're going to find is a lot of these issues start with the gut, start with the microbiome. I'm seeing a lot of allergies, anal gland issues. Yep, allergies. Allergies are a big issue. Dog has allergies, cat has kidney disease. All right, let me get this up on Facebook and then we'll get started, because I appreciate you taking time out of your beautiful day today. Who's having a wonderful day? I know I am, and I'm so excited. Every day I get to share and educate amazing pet parents like all of you. It makes me so excited and lights me up. So let me share this and then we will get started. Labrador is itchy, Laronda. Okay, Annie just finished antibiotics, probably needs probiotics. That's definitely something that can help. Alicia, Cocoa Puffs, our cat has very bloated stomach, rash, both back legs. Oh boy, it breaks my heart. I totally understand. And that is why we are talking about what we're talking about tonight, which I am very, very excited about. All right, so what we're going to do tonight is we're going to go through a presentation. And then if you're able to stay in there till the end of the webinar, I will go through a Q&A. And so what you will see is in that Q&A box, so that question and answer box, I'm seeing we have the chat. Okay, both are working, correct? Perfect. Okay, so the Q&A box, definitely keep that for questions that arise. So that way I have them all in one area, because there'll probably be quite a few questions that come up. So the chat, definitely comment in there, but put your Q&As or your questions in that Q&A box. So we'll go through that at the end. All right, who's excited? Like, raise your hands, right? Is there a raise the hand thing on here? Perfect, I see you guys, I love it. All right, let's get going. So tonight, we're talking about the 3 secret strategies for fixing your pet's gut health issues. And I'm going to take you on a little bit of a journey here. This is where I want to start. I want to start at the broad spectrum picture, the broad ecosystem that we tend to forget about when our pets have chronic health issues, especially. We get so zoned in onto the symptoms, and we tend to forget about this beautiful ecosystem, all the things and how they're interconnected. So when we think about the globe, the world, the earth, we have this. We're just one small part of that ecosystem, right? That Milky Way, there's the sun, and all these other factors that could be playing a part. And then when we start zooming in and we arrive at a field, or still a little bit bigger than our current like localized situation we're in right now, right? As you're sitting in that house, and we see this beautiful field and we think about what is going on in this type of ecosystem that we're kind of zoning down. We're getting smaller. We've got wildflowers, we've got wildlife, we've got fresh air, we have the sun and the wind, the soil, and the soil ecosystems are all going to be playing a part for also our health and our pets' health. And then we go a little bit deeper. We narrow our focus down even more. Maybe you live in a neighborhood like this, where we can't always control what other people are doing, what they're putting on their lawns, what chemicals they're using, or what the city or the town we live in is spraying. Maybe you live on a lifestyle property where you have more control. But these are all very important things to think about because it can create or inhibit healing for us and our pets. And then we zoom in and we're inside the house now, and we have a family and we're seeing like the kids interacting, the food, you can see the animals there, whether you have flatmates, roommates, you have brothers and sisters living with you, you have boyfriend, girlfriend coming and going. I want you to think about the energy of the house, especially right now, the time of this recording, right? It's a bit crazy. It's the holiday season. I want you to think about, is there a bit more stress? How is my pet responding? How are we talking to each other? Is there a lot of yelling? Maybe there's a lot of peace and quiet and all of those things. Now, next, we think about the pets that are involved in this ecosystem. So we're going even deeper. We're starting to look at the minute details of this ecosystem. We might have a dog, we might have a cat, we might have both. And maybe they get along, maybe they don't. And that can contribute also to the energetic part of that ecosystem. And then we dial in and dive even deeper. And we look at the intestinal tract, the digestive system, and we go even deeper. We look at the microbes that make up that microbiome of that intestinal tract. Is it healthy? What's impacting it? What are things from those bigger ecosystems? How are those playing a part? What's going on in the household? How could those be impacting the microbes? And then we even look at how those microbes are impacting other systems in this body. And this higher level overview of all things that can impact gut health are so important. And we have to shift the belief system that a supplement here or there will fix a problem if we have a systemic problem somewhere else in this entire ecosystem. So my hope for you today, like during this webinar, is that you keep an open mind for number one. This is a little bit different. And even if you feel like you've tried everything, to learn more about how you can truly identify where those imbalances may be present, to help you finally fix your pet's gut health and other health concerns for good. So who's with me on this journey tonight? Looking at the bigger picture, keeping an open mind, and ready and excited to learn a little bit more about how to look at your pet a little bit differently. I want to see your hands raised and that. There we go. I love you guys. I love participants during these webinars. It just gets me going even more. So today, I wanted to start with a story of one of my current patients to show you a real life example of how all these different things, those different ecosystems can play a part in your pet not improving if you're currently stuck with a chronic health issue. So this is Roper. He's a 10-year-old Australian Shepherd. We're going to be talking a little bit more about him a little bit further on in the webinar. However, when I first met him, he had really bad back pain. He was kind of crazy. Yes, he's an Australian Shepherd, but his mom's an amazing dog trainer, and she just couldn't get the things to stick with him. And here's the thing, he had been going every single week for chiropractic adjustments, and his adjustments weren't staying, they weren't holding. And we had to look deeper. What we found was once we looked past that little micro ecosystem just in the house and extended our viewpoint to a more broader approach, we found heavy metals, we found lots of glyphosate, pesticides, because they lived on a farm. They didn't use it, but the surrounding farmlands were using it. We also found that he wasn't digesting things as well. And once we adapted and adjusted for all of those factors and those missing pieces, Roper is doing amazing. He's a completely different dog now. So this is the new strategy, finding those root imbalances and addressing those connecting areas that are causing the true issues. No longer just treating symptoms. We are here to find and treat the true issues that are leading to the systems or the symptoms. So here's my ask of you. This is value packed. It's a little different. I want you to keep an open mind, but I also want you to turn off all distractions if possible, so you can tune in and just really dial in and think about where your pet currently is in this ecosystem, where you're at along this path, and learn something new. And so today, what I'm going to do is I'm going to walk you through how to find those root imbalances so you can actually heal your pets, regain or optimize ideal health if they're currently healthy. And I know you might be thinking, I've already done everything and nothing works. You may even be asking yourself, what am I going to learn here? But you've probably gone down that rabbit hole, and it seems like there's no answer that works for your pet. And that's probably why you're here today. Is there anyone here that feels like they've tried absolutely everything and nothing works? Okay, you're not alone if you raised your hand. There's a lot of people here who feel that way. And here's the other piece of this. I get it. I've actually been there myself too. And so when years back, my husband actually developed an autoimmune disease at the start of 2014. And it was an absolute struggle to find what was causing the immune system to be angry. But here's the thing, we didn't understand this concept back at that time. And I've also worked with so many pet parents struggling with trying to figure out how to fix their pets too, who thought the same, that there's no way out. But the problem is it caused them to stop due to the overwhelm and the lack of results, trying to figure it out on their own. And it left their pets in a poor state of health. So what happens if we do nothing? Here's the thing though, right? Have you ever asked yourself, what happens? What's the point? They'll stay the same. When you ask yourself, does the problem just go away if you stop taking action? Well, I can tell you, unfortunately, the problem usually doesn't just go away and pets become more sick. And you may have seen this for yourself, causing you to feel more upset, overwhelmed, and maybe even feel guilty that you couldn't help your pets more. So are you stuck in this, what we call hope strategy? And this is where most pet parents are. They're stuck in this vicious cycle of the same health problem, giving a drug, expecting the problem to be fixed, but their pets might only feel better for like days, maybe months, but the same issues keep coming back. And many pet parents are trying supplement after supplement to try to fix the problem, hoping that the next one works. But it's like trying to fill a bucket that's full of holes with water. We have to fix the holes first. So when you have a bucket full of holes, what do you think is going to happen, right? The water's all going to pour out and you're going to just keep putting things in. But because we haven't patched up those holes, nothing's going to stick. That's a really expensive way to treat a problem, isn't it? So now what I want you to shift to is, do we want to stay where most pet parents are, or do we want to shift to this holistic perspective? When I say holistic, it doesn't mean that we get rid of conventional medicine. There's always a time and a place. Holistic means looking at that bigger picture, that bigger ecosystem that we talked about. And this is where only when you approach the body from a holistic perspective can you truly feel confident that the root cause is being addressed to address the real reason for the problem, aka the symptom, achieve optimal health, and you have the tools to balance and maintain a healthy state without relying on that hope strategy. Having that leaky bucket with all those holes, that's hope strategy. So I want you to put in the chat box, which path do you prefer to take? Do we want to stay stuck in hope strategy, or are we ready for a different change and approach to how we view medicine, how we view the body, how we view the ecosystem to truly find the root imbalance and fix it for good? So who wants the better approach? Anyone? Okay, I see you guys. All right, good. I was like, does no one want to do this? No one wants holistic. Okay, perfect. Different approach, more natural, perfect. Carrie, yes, please. Holistic, Jan, okay, great. You guys are in the right place. Thank goodness, right? Okay, so you're in the right place. If you're ready for that change in your pet's care, you know there's a better way to achieve optimal health, but you're overwhelmed by where to start. You're frustrated, you're tired of all these expensive vet visits, those bills that don't give you progress. You keep going back and forth to the vet clinic for the same problem. You want to know that you're doing everything possible to help your pet live a long and vibrant life. You want that supportive community to help guide you on the right path. You're ready to take action. You're curious about different ways to achieve health in your fur family. Now, here I am, okay? Because I am honest about, I don't want you to waste a single ounce of your time if this isn't the approach you want to take. So leave the masterclass now, go do whatever you need to do if you want quick fixes and you don't care about finding the root cause. This is not the easier way. And it's why so many people give up on it, or they start using natural remedies to treat symptoms like we treat with conventional medicine. If you don't have the time to take action, you think you already know everything about pet medicine. I don't know everything, and every day is a time to learn and learn something new. If you only believe there's one way to look at health, and you get mad when I give you a presentation of strategy that's helped hundreds of pets, and then complain when I make an offer at the end for an exclusive opportunity to work with me, because there is an opportunity here to help guide you even further. Some will take it, some don't, and that's okay, because I will be inviting you to apply for our Better Gut Health program at the end of the call. So just be aware of that, get prepped. There's going to be strategies and tools that I'm going to give to you. So don't worry, we're still going to help you. We still have a Q&A at the end. Just be ready for that. If you're needing additional guidance, that's where it'll be at the end, and how to take up that opportunity with me. So make sure though, first, stay until the end for that Q&A. And if you're ready, excited, give me the thumbs up in that chat box, or there we go. Perfect. Raising the hands, raise the roof, right? So, and what we're going to do is, before I dive into the tactics, because there are a lot of new people here who maybe aren't so sure, who is Dr. Katie Woodley? And I'm going to just talk a little bit about my journey, because it's changed who I am as a veterinarian and helped guide me to being able to help you even better. So when I started my vet career, I started off as a young, naive vet in New Zealand. I'm originally from Colorado. Obviously, I don't have a New Zealand accent, but I was taught and I thought using the big brand kibble food was the best for my pets, and making sure I did all the vaccines and all the dewormers, the things I learned about in vet school. And you know what? I thought I was doing everything right, for my puppy Finn, for our 2 cats that we had, until my husband developed that autoimmune disorder at the start of 2014. And it completely changed how we looked at medicine. I will never forget sitting across from the doctor, hearing the words, "There's nothing more you can do. Here's your immunosuppressives. Sometimes they don't work. Sometimes they do work. Sometimes they cause serious side effects like death." And that was an eye opener for me. And that began the journey. So not being able to do what we always used to do, spending time in the hospital, never getting a clear path forward. But this is where everything changed. I started to learn more about an entirely different world of medicine that focused on root causes versus symptomatic care. And I quickly realized that I could be doing so much better for my pet patients. So this is where I became acupuncture, Chinese herbal medicine certified. I've actually become food therapy certified also. But I quickly came up against other vets in my practice, not liking the type of medicine I practice, because they didn't believe in this holistic approach. And here's the thing, you may be experiencing that right now with your own vets. Is anyone in that situation where your vet may not understand? I want to say understand, just because I don't think they truly understand how it works, but they're kind of against it, right? Whether it's raw food, whether it's against herbs or supplements, they might be telling you, oh, that woo-woo medicine doesn't work. And hearing that what you're doing is not right may cause harm or won't make a difference. Well, here's the thing, because life is full of tests, right? It's what you do with it. What is that? Life is a box of chocolates. You never know what you're going to get. Well, I've had a few of those in my life. And This is where Finn, my soul pup, my German Shepherd, started having seizures and we diagnosed a brain tumor. And this is where we changed him to a home-cooked diet years prior, put him on herbs to help him. We actually avoided 2 knee surgeries, and he was a 75-pound German Shepherd, so we didn't have to do TPLO surgeries. But here's the thing. He was a bit stronger. He still had a brain tumor. He had the seizures, but he wasn't doing well with the conventional meds to reduce the brain swelling. And we were actually told by the specialist there was nothing else we could do. Keep in mind, this is conventional medicine, and he probably had a week left. And so here's the thing though, there was something else we could do for him. And thank goodness I was already on this path in the journey that I had been on. And that's where holistic medicine came in. We were able to give him another amazing year of life with great quality of life when there was literally nothing left on the conventional side. We had been told nothing more. I know a lot of pet parents here have been or may be in the same situation. And I'm here to tell you there is always something else. Even if your vet is saying no, it's just due to they don't know. You need to find other people to help guide you. And that's where Finn helped me realize even more that pet parents are being told every day, there's nothing else you to do, or just wait and see. I hate that phrase, by the way, when there's another world of medicine that you can use. But here's the best part. This is where being able to teach pet parents online, bringing communities together just like this, and being able to help them, just like we did with Finn and all the other pet patients that I have, when we were given a week for him to live and seeing the results, and no one knew he had a brain tumor for his last year of life. My husband's life changed with holistic medicine. Many of the principles are very similar. The amount of times I hear, what you just told me about my pets, I could apply to myself. Like my holistic human practitioner tells me that. Similar principles. There's a framework for healing gut health, healing pet health concerns, and that's where we've turned my years of holistic pet experience into a program. So rather than staying stuck, by following the framework we're going to discuss, you can also achieve success like my own family and patients. So are you ready to learn more? Okay, here's where you got to keep that open mind. Give me that ready. And by knowing how to use these 3 secrets that we're about to cover, optimal pet health is truly at your fingertips. So I want you to start with, imagine where your pet's health could be in 1 year. So think about where they're at. We're at the end of a year. So like, how exciting is that? We're just starting a new year. Think about where your pet could be the holidays next year. So consider this your fast pass, okay? But I want you to take a minute because this is really important. The emotional side of this is one of the most important things to help keep you on this path, because this is not the easy road. This takes time. There will be ups and downs and bumps, and we have to go back to our main motivation for why we're doing this. So I want you to, if you have pen, paper, computer, write down somewhere. If you have a napkin, grab that. Write down the feelings and emotions you feel thinking of your pets living their best, most vibrant lives 1 year from now. Just quickly, doesn't have to be what comes to mind. What are the first few feelings and emotions when you look at your pets? You probably have some sitting next to you, them feeling their best, living their best lives. What are some of those words? Feel free, if you feel inclined, inspired, to put it in the chat, because it'll inspire everyone else. Remember, the collective frequency is very important. And this is a huge part of a journey that's not always the easiest. So drop it in the chat or write it down. Just take a few seconds and put it somewhere. I love that, Priscilla. Happy, relief, excitement. Sandra, happy, relieved. Jan, very lucky and blessed. Carolyn, peace, happiness. Oh, you guys are on fire. I love it. Karina, peaceful, happy that I'm taking care of them. Carrie, calm, right? It's a sense of calm and peace. There's definitely a similar pattern here to how we feel when our pets feel their best. Very grounding, right? They bring a lot of blessed, thankful, happy. Thank you for sharing that. I appreciate it. Okay, let's get into it. So there are 3 key areas that we need to focus on to achieve optimal gut health. Now, keep in mind, when we look at these, it seems pretty simple. It can be, but it can also feel really overwhelming if you're not sure where to turn, especially if you feel like you've tried everything. These may not be new concepts, right? You might be looking at this, I've already tried this. What is this crazy lady talking about? However, like sometimes like your vet hasn't discussed these areas in the way that we're going to talk about them tonight. So once again, going back to the beginning, we talked about the ecosystem. And so I want you to be thinking about all these other little factors that could be playing a part too, as we go through these 3 key areas. Secret 1, no surprise, right? Nutrition. Food is the foundation of health. But when we look at food and we look at nutrition, we have to look at the different areas where nutrition is supporting the body. How is it helping the body to function? How is it supporting the microbiome? Do we have an imbalanced gut microbiome? Do we have an inflamed gut lining, like leaky gut? And how can we use functional foods to really support the body, the mind, the microbiome, overall health, reducing inflammation? Now, why is nutrition a secret? Okay, so Butters here is a great example. So Butters is one of my patients who came to me for kidney disease, mast cell tumor, and we were able to put Butters onto a higher protein diet, which most veterinarians recommend prescription low protein diets. Butters also had IBD. And so by using the right types of food, fresh, whole, unprocessed foods, using the right herbs and supplements to help heal the body, we were able to help Butters. Butters is still doing well. Butters actually has a squamous cell carcinoma that was diagnosed over 6 months ago. Butters was given a life sentence of a month and exceeded all expectations. And this is where the power of nutrition and optimizing gut health can play a huge part. And you may be wondering, like, why is nutrition a secret, right? I mean, unfortunately, so many people have been brainwashed into thinking that real food is dangerous and that it must come out of a bag. But I want you to think, like, what do Cheerios have to do with pet nutrition? So who here would eat Cheerios? Hopefully no one. If you are, this might make you rethink things. But think about this. If you were to take your baby to the human doctor and they gave you a bag of Cheerios and said, this is all you need to feed your kid from baby until they're an adult, every single meal, every single day of their life, it's nutritionally balanced. It's, what would you say? You'd probably run out of that office and go, I'm never going back to them. However, veterinarians are the only medical profession that recommends a dry, processed kibble diet for the life of your pet. Now, here's the problem, is that when we talk about the microbiome is this trillions of different types of microorganisms, bacteria, fungi, protozoa that are living in the digestive tract. Now, here's the thing, we're going to be talking about just the gut microbiome, but every organ system, even the skin, has a microbiome that's essential for optimal health. And microbiomes are a little bit similar between cats and dogs. They can differ in abundance of specific strains and phyla and the diversity between those strains. And here's the thing, it can vary according to breed, diet, age, and environment. And the gut microbiota is significantly influenced by diet, like the type of diet. When we do animal biome, microbiome stool tests, they can actually tell if you're feeding a raw diet or feeding a processed kibble diet because it will change the types of bacteria present. Now, why is the microbiome so important? For one, it helps to break down the food. It produces these things called short chain fatty acids, secondary bile acids that are going to also help with binding toxins, processing fats. They help produce vitamins, nutrients, hormones, neurotransmitters that are key to the body functioning well and being healthy. It also is directly connected to and helps mature and develop the immune system. About 70 to 80% of the immune system is actually within the gut lining and communicating directly with that microbiome. So if that microbial barrier is not working properly, or it's in balance, what we call dysbiosis, that can directly impact the overall health of your pet. And there's also what we'll talk about, a gut-brain connection too, where it can actually lead to things like behavior issues or other symptoms like skin problems that don't even seem related to the gut, but are actually due to a gut health issue. So what exactly can affect the microbiome? Once again, the diet type is very, very important. And what's neat now is we're getting a lot more studies. So this is where, if you have a vet that's against like feeding a raw food diet, or you making your own balanced diets at home, you can bring these studies in to showcase this to your veterinarian. And the balance of bacteria in the gut can be thrown off by the administration of antibiotics, other medications, including proton pump inhibitors, non-steroidals, antidepressants, pretty much any conventional drug. And here's the thing, one dose of antibiotics can wipe out the entire microbiome. And what happens is it leads to this unhealthy imbalance of good versus bad bacteria. We lose diversity of the different types of intestinal microbes. We call that dysbiosis, and it can last for months or even years after an antibiotic course. And this can lead to this dysbiosis in that microbiome inside the gut layer. So this can lead to a breakdown of tight junctions between the gut lining. This is what we call leaky gut, so an inflamed gut lining, and that allows bacteria, toxins, food particles to pass through, enter the circulation, the bloodstream, stimulate the immune system, and cause inflammation. So this can lead to all sorts of things like allergies, anal gland issues, ear infections, chewing on the feet, behavior problems, and other inflammatory processes in other organ systems. That is why the ecosystem is so important, and also why gut health is so important to look at, especially if your pet is dealing with a health issue. Now, this is kind of scary. There's been some studies that show us how long after certain drugs these changes in the microbiome can last. So metronidazole creates that dysbiosis, remember that imbalance, good versus bad bacteria, and it leads to major disruptions in intestinal metabolism. It affects bile acids. Once again, bile is really important for digesting fats, breaking down fats, grabbing onto toxins, getting it out of the body, and even tryptophan. Tryptophan is really important for mood, behavior. And this study showed for at least 4 weeks. Well, the study ended at 4 weeks. So this happened at least 4 weeks in. And then in humans, some of these alterations in the gut microbiome have lasted 4 years after just a short course of antibiotics. So I can imagine this is also happening with our dogs and our cats, and why we have to look at, do we truly need antibiotics rather than just blanket treating whenever we have diarrhea or GI upset, just throwing metronidazole or Tylenol powder? We need to be looking at, well, can we use slippery elm? Can we use marshmallow root? Let's fast them. Let's use bone broth. Let's use Saccharomyces boulardi, a beneficial yeast that has so many studies to show that it can help with diarrhea, versus jumping straight to antibiotics. And it's all for these very reasons. And some of these common nutritional imbalances, this can come from unbalanced diets, can also come from other factors we're going to talk about too, some other secrets I'm going to reveal to you. But these are common imbalances where if we're not feeding, if we're only feeding an 80-10-10 ratio with our raw food diet, so that's 80% meat, 10% bone, and 10% organ meats, those diets over time will be deficient. Kibble processed diets will be deficient over time. Okay, I said it. I probably get raked over the coals for saying that, but I feel like I'm in a safe place here. The reason why I say that, even though they're adding synthetic vitamins and minerals, because they are produced and processed at very high heat temperatures. So yes, at the start of it, maybe we are balancing it with synthetic vitamins and minerals, but what is happening through that processing stage? And also too, what's happening when we add in other chemicals, things like glyphosate, heavy metals? That's where we have these nutritional imbalances when we do some of the testing that we're going to talk about, and we can actually see it in our pets. Now, how do you know if your pet's got an unhealthy gut? So if your pet has some of these symptoms, there's probably some component of dysbiosis or something off in the microbiome. And the food you're feeding your pets, and the rest of this webinar just got even more important if you're seeing this. So weight loss, dull hair coat, autoimmune diseases, allergies, sensitive GI tract, so acid reflux or GERD, diarrhea, vomiting, hairballs. That is not a normal finding for cats. Hairballs are not normal. It is common. Same with vomiting in cats. Common, not normal. And this is where dental disease, bad breath with clean teeth can be a sign of an imbalance in the microbiome. It can be a sign that we have too much acid or not enough acid. We have a SIBO infection, inflammation, ear infections, anxiety, thyroid issues. These are all interconnected. And so when we look at leaky gut syndrome, so remember, let's take 2 steps back. So we have the microbiome in the gut. And what happens if we get an overgrowth of bad bacteria to good bacteria? We don't have enough diversity or strains present. It can lead to inflammation in this gut lining. So what you'll see here, can everyone see my cursor? So you have your intestinal, let me know in the chat if you can see my little cursor across here. So you've got your mucosal cells. Okay, perfect. Thank you. This is where the food is up here and the microbes. They should be staying up there. They shouldn't be crossing over into the bloodstream. So we have our normal tight junctions. Keep in mind, this gut lining is 1 cell layer thick. And so what happens is if we have this dysbiosis, if we have a lot of inflammatory mediators, chemicals, toxins coming in, it creates this leaky and inflamed gut lining, and it allows bacteria, protozoa, and toxins to pass through. We have our bloodstream sitting right here. We have our immune system sitting right here. There's some immune cells up here in this mucus lining. We're not going to go that in depth tonight to help prevent these crossing. But what happens then is the immune system becomes overstimulated, and it creates all these different complexes. So it can go directly to the brain through the vagus nerve. We can get more inflammatory mediators being made. We can actually develop autoimmunity. So we're having immune cells attacking ourselves. We can have malabsorption, nutrient deficiencies, and we can also see like food sensitivities. So food allergies are very uncommon in pets. Food sensitivities are more common. They can change. And this depends on right here, this leaky, inflamed gut. And if we're allowing food particles to pass through, the immune system goes, this is a foreign substance, and they create an antibody against it. And that's why when your pet eats it, it creates those ear infections. It creates more itchy skin. And this is also where, too, we get secondary yeast infections. Yeast is secondary to an imbalanced microbiome. It's not primary. So we have to treat this first before we even go to the yeast. So I want you to meet Leo. He's another one of my patients. He came to me as a 2-year-old golden doodle with chronic GI upset. He was put on a prescription diet right away, of course. Bland diets always work, right? When you reduce everything, especially when they're processed. That was complete sarcasm. I'm not a fan of prescription diets. There's a lot more we can do with food to help them. But however, this is not shocking. He was still having episodes of boulardi diarrhea. That is why they found me. And so what we did is we adjusted his diet, we reduced toxins, we put him on a balanced homemade food recipe using food therapy principles, and we supported his gut health. We used things like probiotics, digestive enzymes, soothing nutraceuticals that are going to help seal and heal that gut lining. Licorice, L-glutamine, slippery elm, marshmallow root also works well. And here's the other key component with Leo. He didn't live in the States. He's actually an overseas client, and we were able to still use things to help him. That's the power of understanding, why are we using something and what are we using it for? Very, very different than just throwing supplements at them because we heard it was good. So that Leo's doing really, really well now, but this was also part of this is testing. We're going to talk about these tests. This is just one of many different tests that we can do, but I really like these hair tissue mineral analysis tests because this is Leo's test. I know it's a little bit small, but what you can see here is we have high sodium, really high. That is not salt in the diet. This is a sign of adrenal stress and levels of inflammation in the body. And then 2, high levels of chromium. We've got copper, imbalance to zinc. So we see these in the ratios down here, and I don't expect you to understand how to read these. That's what my job is. But here's also, so calcium, magnesium is low. Leo was really reactive, like would go off his wire when dad would come home, really hard to settle. Calcium and magnesium down here are tranquilizing minerals. Many pets have this. So if you have a hyperreactive pet, if you have a pet that's really hard to train, has behavior issues, this is one of the other reasons why I love these hair tissue mineral analysis tests, because this is telling me, for one, he was on a prescription diet. We need to support digestion. His phosphorus is down. He's not breaking down his foods well to absorb. He's using digestive enzymes can be helpful when I see this. And then also here, under these toxic metals, his aluminum is high. So aluminum can come from a lot of different areas, but they can be born with them. It can be part of vaccines. And so when I see this level of aluminum, ideally I want this less than 2, less than 1, ideally. Every pet will have mercury and aluminum, never seen it 0. But with that aluminum level, that's going to also be causing that hyperreactivity. It's going to bind to nutrients and minerals. It's also going to affect the microbiome, and it can bind to glyphosate too. Glyphosate is like Roundup. It kills the microbes. It works on the same pathways as the microbes need to survive on, that shikimate pathway. So we need to address that. So detoxification needs to be a part of Leo's protocol. So I hope you can see how we broaden that approach. We do some personalized testing. We understand that there's these different areas all interconnected, and we need to support them in certain ways using nutraceuticals, supplements, and using food as medicine. Because here's the thing, the food you eat can be either the safest and most powerful form of medicine or the slowest form of poison. So really important. Now, here's the next secret, right? Environment. So toxins, pathogens, emotional health are going to play in this. As you saw in that last with Leo, your toxins, your aluminum is going to be a huge issue. That's going to be acting, that's a toxin to the body. If we have pathogens like Giardia, or we're diagnosing parasites, and all we're doing is throwing, DGL at them, deglycerinized licorice and slippery elm, and they're not getting better, we need to take a step back and understand there may be something else causing that. The other piece to this too is emotional health can play a direct impact on creating leaky gut and a dysbiosis. So dysbiosis first, then leaky gut, because of that gut-brain connection. So if we miss this, we miss big pieces to helping to heal our pets. And this is why this area is so important. This goes back to my Finn, my soul pup. God bless him. I loved him dearly. He is still a huge part of my mission. We lived in a toxic environment. There was a lot of heavy metals and sprays that were being used around the apartment complex, and I just didn't know. I did not realize the importance of that and the importance of heavily supporting his detox pathways. I know different now. And so if you're on that path of the journey, that's okay. You are here to empower yourself so that we can all do better to help our pets wherever we're at on that journey. And there's a lot of different toxins out there. So we're all being exposed to over 85,000 toxins a year. That number is increasing. They are creating new chemicals every single day, every single year that we are being exposed to. This is a part of our life, and it's not meant to scare you. I always say that it is meant to empower you, because when we know, we can do better. And there are invisible things that are impairing your pet's gut health. They're increasing inflammation. We can't see these things. So glyphosate, your Roundup, once again, it targets that pathway in the gut microbes to kill them. 90% of rainwater contains glyphosate. Processed pet food is high in glyphosate. I'm going to show you some studies. It's really scary. That's just another reason to get away from processed pet food if you can. Flea and tick preventatives. These are toxins. They are neurotoxins, a lot of them. Vaccines, heavy metals, stress, mold, formaldehyde gassing off of like new furniture, blood sugar. If your pet's overweight or they're on foods that are increasing oxidative stress in their body, that can increase inflammation. Oxidative stress is inflammation if we're not clearing it. Free radicals, once again, oxidative stress. This is why your pet's environment is so important. So this is just a study that was done with herbicides in the urine of pet dogs following the whole, like applying chemicals to the lawns. And then HRI, they did a study to show the levels of glyphosate measured in urine. So there's 2 studies here. So on the right-hand side, so over here, this was based on pet food. So they were fed dry food. So I want you to look at these animals were on a dry food diet. Horses, of course, because I didn't mean that. Horses, of course, too. So they're on a lot of oats. They're on a lot of wheat. Those are sprayed with glyphosate at the end of harvest. So it's going to be a higher concentration. Dogs that are on grain-free diets they have oats, wheats, legumes. Those are the highest concentration of glyphosate. Cats are a little bit less. And when they compared these to raw-fed diets, raw-fed animals, the amount of glyphosate was minimal. That's crazy, right? But that's because we're feeding fresh foods that aren't being sprayed. Now, in this study, this is showing an increased risk of bladder cancer when we are applying herbicides. So I see this, I've seen this for years, and it didn't make sense until it clicked. The amount of bladder cancer I've seen over the years has increased tremendously. And now one of the questions I always ask my clients, especially if we are like treating for bladder cancer, is, do you live near a golf course? Now, it shouldn't be a question I ask for just bladder cancer. It should always be a question and something to look at. You may not be able to move away from where you are. That's okay. But if you live near like a golf course, or you know that there's a lot of sprays or chemicals and pesticides and herbicides that are being used, then we can do better with opening up those detox pathways and supporting our pets so that they can clear those toxins. This is also one of the FDA alerts. It's been around since 2018. That's how long this has been out. And we're still, as a veterinary profession, these products, these isosazolazine products are still on the market. I never would recommend any of these. I don't care if I would rather have a tick bite than risk the potential side effects of these drugs. So next card, Brevecto, your Revolution Plus, Simparica, they're bad. They cause seizures, behavior changes. They are just not good. So 100% do not use them, cut them out. There are a lot of great natural remedies you can use. Once again, it's harder and you have to layer them because they are repellents. They are not insecticides. So they're not as strong. But if you won't put something on yourself or take something internally and you are giving it to your pets, why are we doing that? That's a great question to ask yourself every time. If you're applying topicals or you're giving them one of these flea and tick products, would you take it yourself? Like the Seresto collars, like they're like, don't touch your pet. And we're like putting it directly on their skin, like crazy madness, right? So things to think about. And then when we look at oxidative stress and those detox pathways, the gut is a major detox pathway. It's not just the liver. So I want you to think about the gut like this clogged up toilet, right? If it's not functioning well, detoxification is not going to work well either. It gets backed up and we got to like unplug it and open up those pathways. And there's different phases of detoxification that we have to be aware of, like the elimination phase, phase 1, phase 2, phase 4 of the skin, making sure all of those are working well. Those toxins need to get out. And if there are nutritional deficiencies or your pet's unable to absorb the nutrients from the food because they're lacking digestive enzymes, they might be lacking stomach acid to activate things like pepsin and digestive enzymes and stimulate the pancreas. Detox might not work efficiently either. So going back, remember when I mentioned a lot of these foods that are deficient or recipes or diets that are deficient in these types of ingredients? This is why it's really important, because many of these vitamins and minerals are found in these detox pathways. So this is a great diagram where it shows this is the liver. Liver is one part of the detox pathway. There's also your kidneys, there's your skin, there's your gut. So the lungs, we can't forget about those other pathways, but your liver is your powerhouse. Fat soluble toxins are coming in. Phase 1 needs to occur. We need these nutrients for phase 1 to even occur. So think about if your pet's deficient in B vitamins, is it going to work well? If they're deficient in vitamin E, which is really common for a lot of pets, especially if they're on homemade or 80-10-10 ratios, is it going to work well? Toxins come in, they're going to just get stored. The other thing too is, so next step, that step 2, if we're not adding in things and making sure that our pets have enough taurine or amino acids, or, utilizing those cruciferous vegetables that are high in sulfur, that's not going to support step 2 either. So it gets stuck. Where do the toxins go? They get stored in fat and muscles and bone and the organ systems. And if everything's working, we get to the waste products, right? And hopefully it's eliminating. But if you have a dog or a cat that's prone to constipation or even diarrhea, or their gallbladder's not working well and the bilirubin's not, that bile's not working, things can get backed up. Or maybe they have kidney disease. So there's all different ways to help them, but I want you to think about this detoxification pathway and these different phases and the different nutrients and how we can utilize food to supply a lot of these required nutrients, and how we can also use nutraceuticals to better support those different processes and pathways. And this is a it's hugely missed area, is emotional health, especially right now. Who here feels a little stressed? I mean, it's a great time of year for a lot of people, but this time of year is also really stressful and lonely. And I see you guys, and it's not always like a joyful time of the year, or it can be really, really stressful. And thinking about bringing families together, it may not always be the least stressful thing, right? And so your emotional health, the family dynamic, is also something you need to keep in mind. And this is an interesting fact, is this interconnectedness that our pets have with us is why so many pets have the same health condition as the pet parent. Does anyone here have that same health problem that their pets have? I find it a lot of times with GI issues, IBD, stress. That's really, really common. Or, behavior things too. If you're anxious, your pets tend to be anxious, and our pets are absorbing a lot of this. And this is where that emotional health and being able to give you tools and support to really bring down that stress and reduce that can make a huge difference for your pets. And neurotransmitters. So this is where a lot of this comes into play with the microbiome. So I love this chart because from this study back in 2015, where it shows the different type of bacteria that make different brain chemicals. So these different neurotransmitters and messengers, and serotonin, 90% is produced in the gut. And this can affect mood, sleep, behaviors. But what's really neat is we can use dietary changes to affect behavior. We can also use things like fecal transplants to also help support a healthy microbiome. And these same neurotransmitters are actually being used, that are produced by the gut, are being used also by the brain for cognition. And this is also why, if I am supporting a pet, a dog or a cat that does have some anxiety, or there are behavior issues, just like Roper, one of my patients that I've talked about previously, where he had a lot of anxiety, he just wasn't easy to train, very reactive. I always look to the gut, because usually there's an imbalance. And so you can see like the bacillus bacteria, dopamine, norepinephrine, bifidobacterium makes GABA, enterococcus makes serotonin. So we have to keep this in mind. Once again, everything is interconnected. And that's where this brain gut axis comes in for mental health. So those behavior problems, compulsive disorders, aggression, anxiety, phobias, there's numerous studies now that have shown different microbiomes for these pets that are showing these behavior issues versus a healthy, like well-behaved pet. Also with cognitive decline, it can come down to a microbiome issue. So we can help our pets age gracefully by making sure we're supporting the microbiome. And seizures too. There's a ton of research through the Keto Pet Sanctuary showcasing higher fat diets, using MCT oil, supporting the microbiome, using fats, affecting digestion, right? Affect the brain because of the gut-brain axis. So this is huge, right? And if we miss this, which is very, very easy, then we have an issue. We get stuck on that treadmill, and we keep treating symptoms over and over and over again and throwing supplements after supplement, hoping that it works. And this is where Secret 3 comes in, that testing. This is where it can speed up the process. Yes, a holistic approach can take longer, it can be more frustrating, but this is where this can help you get to the root and balance. This is how you get out of the hope strategy, finding the root balance. Why? What reasons? Why is your pet not healing? We need to always be thinking of how everything else is also connected and could be affecting the healing. So again, that emotional health, commonly missed. So we are really, really good at saying we're fine. I do it all the time. I am notorious for this. I'm fine. We just need to get through it. Where in reality, I just need to take a breath. I need to take a minute and sit and breathe. My cat sits here. You can't see her right now. She sits on my desk, and she is actually a really good reminder when I look over at her, she's sleeping right now, to take a breath. So what clues can you bring in for that? What chemicals, also toxins and pathogens that we just talked about, assessing that environment, what's going on, being able to think about the nutrition that we're feeding. Where can we optimize diet? Not everyone's able to get away from kibble. That's okay. How can you better improve the food using superfood toppers, using medicinal mushrooms, using some of those cruciferous vegetables as a whole fresh food topper to increase the amount of nutrients that you're putting into your pet? And this is where some of these gut health testing, a lot of this is going to look at the whole body, right? We don't want to miss something. So I just listed a couple examples of things that are going to affect the gut health, the microbiome, that are going to affect behavior, that are going to affect if allergies are being healed. So diversity, dysbiosis, animal biome does stool tests that you can order directly from home, looking at the function. What is the level of inflammation? Do we have leaky gut? There's quite a few newer companies now out there doing some tests to help identify that. So Innovative Pet Labs, IPL, they have quite a few tests now for both dogs and cats to help identify, is the gut inflamed? Is detox working well? Do we have leaky gut? Are we having a food reactivity to wheat in the diet? So if you are feeding a kibble, I highly recommend doing that test from IPL so you can get a better idea if your pet is adversely reacting. We don't always see symptoms at first, but we're all on a spectrum. We will be constantly moving either away from health or towards it. And if we can do some of these tests as a preventative to see where is the level of inflammation in our pets, it can help guide you and also increase the importance to do something now rather than waiting until we have a full-blown crisis. I've been there. My husband has autoimmune disease, a lot harder to reverse it and fix it. Been there. My dog had a brain tumor, much harder to reverse versus understanding these principles, these secrets, right? And going into it and assessing these areas and just doing some preventative care tests. You don't have to do all of them, but they can be very powerful. NutriScan is a great one for looking for food sensitivities. Our hair tissue mineral analysis tests, we're going to go through that because it's just one of my go-tos that I love, alongside blood work. If you haven't checked for thyroid issues, please make sure you are checking for thyroid issues at least, doing a full CBC biochemistry. Those are all very, very important tests, especially if you are dealing with a chronic health issue. And this is where it's also very important to have the results sent to you from your veterinarian so you can keep track of everything and also see what has been done. Now, these hair tissue mineral analysis tests, a lot of vets don't do them. I found them recently, and over the past year and a half now, these tests have been a game changer for being able to identify when we have nutritional vitamin deficiencies. It also helps us look both at like disease trends, looking for stress, and how well is your pet psychologically, physiologically coping with what's going on in the food that we're feeding them. And so what it does is we take a fur sample and it gives us a reading of the mineral deposition in the cells surrounding those hair follicles. So it gives us an example of what's been going on in the body over 2 to 3 months. We can't get that from a blood test. And this allows for improved recommendations for vitamin, mineral supplementation. And it also shows us the stages of stress. So zinc and magnesium tend to be lost first when we become acutely stressed. Calcium and copper can be lost in the middle stage of stress where the body's trying to balance and trying to get us to take a breath. And then loss of sodium and potassium are exhausted with exhaustion stage of stress. So malabsorption will affect specific minerals. The types of foods we feed will affect that. Toxins like herbicides can act as endocrine disruptors, so it'll affect the hormones that also influence nutrients. And those toxins like glyphosate can also bind to nutrients and make them unavailable. So this is a great test to see like a snapshot of cellular health over the past 3 months, and then fine-tuning the treatment plan based on the individual pet, so we're not just guessing. So once again, Roper, looking back at Roper with where he was at 44 for his aluminum, really, really high. And we were able to, the last test we did back in March, we'll repeat another test soon, we were able to drop it in half because we opened up the detox pathways. We helped eliminate those toxins. We also got the nutrient status back up. So why is this all important? Rather than guessing what's going on, you now know and can monitor the progress of what you're doing. So what this means is you save money by only using supplements that are needed, using the right foods to heal. Once again, can be superfood toppers on top of a processed food if that's all you're able to do. Every little bit matters. And know that you're making a positive step in the right direction to healing your pet's imbalances. Now, who here sees the importance of that? Rather than just guessing and hoping that something works, this is such a better way to know that the things we're spending money on, those supplements that aren't cheap a lot of times, are actually truly needed by the body. And then being able to use different tests to help guide us so we don't always have to continue to use supplements. We don't want to use supplements for life if we don't have to, and I don't want to use the wrong supplements. So here's the thing to keep in mind. It can feel really overwhelming, right? But when you have a partner to help guide you along the path, a holistic life becomes easier every step. So with my own family, we took one step each day, built a foundation following these steps. And this is how my clients heal their pets using the Better Gut Health Program. This is the pathway we follow. And I want to introduce this concept to you now that you're aware of the impact of the environment, nutrition, stressors on your pet. So then you can proceed to actually taking the action to fix it. So we start with like removing things. What are some of the factors that might be increasing inflammation, causing stress that we need to remove? How do we replace vitamins, minerals, like digestive enzymes? Do we need to re-inoculate that gut, that microbiome? Do we have that dysbiosis imbalance? How do we repair that gut lining, that one cell thick lining, using nutraceuticals, soothing nutraceuticals and herbs and supplements and whole fresh foods using food therapy? And when we do all of those, we get a healthy gut. But here's the thing, like many make the mistake of starting with detox first. I'm sure some people here, there's never any judgment. You start with like milk thistle, right? Everyone uses milk thistle and it's not right or wrong. But if the gut is sluggish or it's not functioning well, toxins can get stuck. You saw those different phases of detoxification. And also too, if we don't have those nutrients, we have nutrient deficiencies, detoxification, and the immune system will not work well. So we stay stuck in the same pattern of seeing the issues. Toxins can continue to build up because they're still coming in, but the body's not able to process them. So these 4R protocols to a healthy gut that remove. So this is a list that you can go back to that we follow during our program every step of the way, going through each of those scenarios with personalized testing to help guide you to make sure that you're not missing something that's keeping your pet stuck and from healing these chronic health problems and keeping you frustrated and worried. So we need to remove, replace, re-inoculate, repair. So those 4 R's, and I even added a fifth one, reset, for emotional health too, because it's so important. So that's also part of the program. And I want you to meet some of those patients whose lives have changed through using these frameworks, because there's a lot of patients out there. There's a lot of members that have gone through this program and gotten really good success. These two here, Piper and Cub, they were patients of mine. They've actually moved out of state now. They had chronic allergies, behavior issues, and we had to shift their diet off of kibble to a homemade diet and use supplements through those 4R protocols to help get them back to health. It made a night and a day difference. Now, this is Reggie. He's one of my acupuncture patients, and recently he's an older Labrador retriever. He's got some severe back pain, tight muscles, where if he loves playing ball, if he plays too much, he gets real like spasms, and then he started having some diarrhea. So what we did is we were able to transition him to a lightly cooked food off of his kibble, which he absolutely loved. It changed his life. And then we also put him on things that are going to help naturally reduce inflammation, also support the gut, support the endocannabinoid system through things like CBD, We use acupuncture treatments. We teach how to use acupressure on certain points to support the gut health, reduce stress, reduce anxiety, support the immune system. So just because you can't access acupuncture if you don't have an acupuncturist close to you, you can still use the same points that I use with my own patients to support them the same way. We can also use gut supporting supplements. So this is where those nutraceuticals like L-glutamine, your deglycerized licorice, depending on the pet, this is where not just throwing all the things at him is very important, because that, for one, mom was very cost conscious because she was switching to a lightly cooked food. We use some natural anti-inflammatories like curcumin and omega-3s to really support those joints and also bring inflammation down. Reggie is doing fantastic, and I see him probably about once a month now, and he's doing very well, feeling great, and loves his new food. This is Tico. He's actually one of my recently adopted cats last year, and he came to us and he had a vaccinosis. He had a reaction to a rabies vaccine. He was very, very sick. We actually thought he had lymphoma at one point. He's a 2-year-old cat. He was not neutered when we rescued him, and we thought we had very limited time with him. So this is where we followed this protocol. Using homeopathy, we were able to help with that vaccinosis. We were able to use gut supporting supplements. We were able to put him onto a raw food diet. I feel like he was probably supplementing himself outside where he came from. So he was a very easy transition, thank goodness, as a cat to a raw food diet. And then we also supported the emotional health side because we brought him into a home with 2 other cats. You would never know anything is wrong with him now, and he's doing fantastic. So by looking at all these different areas, making sure we're not missing a part of the ecosystem, we supported his detoxification pathways, reduced inflammation, supported gut health, gave him a quiet, calm area to heal. Tico's doing great. And then there's also Moki. So Moki came to a cerebellar hypoplasia, so he's a bit jerky. He's a mild case. It doesn't affect his quality of life. It's not painful. It's just more entertaining to watch him eat. So he eats like a bird. However, he was a rescue as a kitten. So he grew up in a foster home. He was terrified. He had upper respiratory infections. He was vaccinated 3 times before we got him at 10 weeks old. He had multiple rounds of antibiotics and was already on a prescription diet for diarrhea. We were told he would need to be on that for the rest of his life. So it took time with him, and there's still some sensitivities that we work around and continually support the healing of his gut. And we know there's, some brain issues there that will always be there. However, he is on a raw fed diet, doing great without GI issues, diarrhea, has not needed any antibiotics. And this is where there are so many different ways to support the body. So we use herb gardens with our cats, putting down dried organic herbs for them to self-select. This is him self-selecting rosebuds, so you can kind of see him, he moves very kind of radically, but he loves these, and it allows them to pick and choose what their body needs. We also give them a lot of environmental enrichment to engage them in a multi-cat household. These are very important. So there are many different ways to support them. And where to start, right? I want you to keep it simple. You do not need to start with all these different things, but we need to assess these 5 pillars of health, assessing it from those 3 secret strategies. So what nutrition are we using? Is it supporting gut health? Where are we at with removing, replacing, re-inoculating, repairing? Have we done those tests to figure out where those gaps are? Have we truly assessed our environment to reduce and remove some of those toxins where we can? Have we actually assessed emotional health? I think that's something that every single day, especially during the holiday season, is very important to do, to see, how do I feel today? Okay, I need to make sure that I do have self-care today so I don't affect the animals, because they are super absorbent of our emotions and what's going on in the house and any stress. And it will manifest as symptoms, as a gut health issue, because stress directly creates leaky gut. There are numerous studies that show that. So we need to be aware of that. And then, are their physical health needs being met? Are we walking the dog? Are they going for safaris? Are we getting them moving to help with the lymphatic system, which is draining those toxins? And with our cats, they shouldn't sleep all day. So how can we get them and engage with them to get them moving and playing? Once again, get that lymphatic system moving to drain those toxins and also continue to support optimal brain health and gut health, get them moving so digestion is moving, elimination pathways are open. And here's something to keep in mind. I started with holistic medicine because my husband was sick. So I went down the rabbit hole, hours and hours, years of research, additional certifications, degrees. And you may already have a pet with allergies, cancer, or another disease, and you vowed to yourself to do everything possible to not go down that path again. Or you want to do everything possible to keep your fur family healthy. So those small steps and support from people who've been there before are so much more important than the naysayers and people who don't believe in your journey towards holistic medicine for your pets. I promise you that. It can be hard being different. Believe me, I get it. But your time is now and you need solutions now. So this is not just theory. I've been sharing the system with one-on-one clients like for Leo, Reggie, Tico, Roper, Moki, Finn, Butters, and so many more pets. And I've tested this entire system and proven its results with many pet parents now and our other clients. And at this point, I know I can make a greater impact by sharing it with more people, which is why I'm here today. So this method's time tested, it's proven. Yes, holistic medicine can work to achieve optimal pet health and health gut issues when you follow these frameworks. And I'm using some of these strategies for this webinar you're on right now, plus many others to help pets feel their best. So if you're thinking, I'm ready, where do I start? All you have to do is commit, focus, and take action. Here's the thing, you've already done that by taking time out of your busy day to be in this masterclass today. And I applaud you for that. So I just gave you a brief glimpse, very small snippet at the Better Gut Health program. But as I'm sure you can imagine, this is just that tiny tip of the iceberg when it comes to achieving optimal gut health, finding those root causes and those imbalances and actually truly healing them. So here's the thing you can do. You can either continue to try to figure it out yourself, or you can actually get the proven success path with support and guidance. Now, why, right? There's the biggest issues I see with the online pet health space is there's a lot of info out there, right? Who can agree with that? Does anyone else think there's a lot of info out there? Each one is trying to teach an aspect of this intricate puzzle of holistic pet care. There might be in a Facebook group on why you shouldn't use conventional medicine, but that's not helpful if you don't know how to safely and effectively use holistic medicine to treat the root imbalance, not just the symptom. That's the key. A supplement for gut health, that's great, but if the root imbalance is missed, inflammation continues and you may not even know it. And your veterinarian telling you raw food is toxic and will kill your pets is super confusing if you don't have the tools and studies to share with them to have an open conversation. So I wanted you to have the best possible launch pad for a healthy, long life for your entire fur family, because I've been through it. I'm coming at this with years of experience, experimenting, finding the things that actually work long-term, studies, research, training, certifications, versus just using trends or using hope strategy. So these are just a couple of my current clients that have graduated from the Better Gut Health program. So this is Jacqueline. So as a first-time dog owner, I wanted to learn everything I could to give my dog the best foundation. At 2 years old, she didn't have many health issues, but had started developing allergies. The Better Gut Health program gave me the roadmap I needed, along with individual support, to get her to optimal health. Not only have her allergies resolved, but she seems happier and healthier all around. I feel more confident now in caring for her and have many tools if other issues arise in the future. I'm so thankful to have been able to learn from a vet that's incredibly knowledgeable, empowering, and holistically minded. So that's Luna. And then we have Kelly and Dave. That's Dave in the photo. So I've really enjoyed working with Dr. Katie with my dog, Dave, a 9-year-old small long hair Chihuahua. Dave has had chronic GI issues, actually severe IBD. So for 6 years, and no one has been able to help him. He's been so frustrating. Dr. Katie is the only vet I've worked with that can place all the puzzle pieces together. Dave is doing really well after 6 weeks, and I look forward to continuing my journey with Dr. Katie. She's the best, dedicated, whip smart, logical, positive, and understanding her program is intuitive in all ways. Can't get better. If you're thinking of working with her, it's worth every penny. And then Bethany, that's Spartacus, a handsome Spartacus. The biggest positive impact that I've noticed right now is my new confidence in knowing that what I'm giving him, new supplements, is right for him. I do not feel like I'm guessing. I have new hope and definitely feel like I'm doing something different to help Sparty. I have seen a positive change in Spartacus. And then a final testimonial from Lauren, who's been through our Better Gut Health program also, this is Buddy. I'm thankful this year to see my boy feeling his best. At 17, I really had no idea how to raise a dog. Buddy made it the easiest thing, the best puppy I could ask for. He's been by my side through so much. My whole heart will forever be with him. I've never given up trying to find someone to help us find real solutions for his health. I don't even know what try we are at, but it doesn't matter because we are finally where we need to be. Here's to the best health. I'm finally looking forward and not back. Also, can I believe he's close to 12 years old? Nope. Thank you, Dr. Katie. Thank you. So these are what light me up. Seeing the changes, seeing these pets, seeing these soul animals, and seeing what can happen when we follow these frameworks. And it can happen. It's once again, not always easy, but this right here is why I do this. And this is why I want everyone here to have additional options and support and guidance. So my dream pet parent wants to do everything possible to achieve optimal health and gut health. They love learning and participating. They're not afraid to ask questions. I love questions. It means you're thinking about things. And they're kind to others. They love being a part of a community, and their fur family's health is as important as their own. They want all the options. They love getting results, and they're not afraid to try things that are a little uncomfortable. So I want to ask you, are you next? Are you ready for the next phase of the healing journey? Now, the better the fit, the better the results, of course. And I want the right pet parents who are ready to believe, take action, and want the results. So who here wants in? Let's go through how that process works. I appreciate you guys all still being here, participating. This is who this is for. Pet parents, pet store owners, trainers, people who want to learn more about holistic medicine and gut health and how these things are connected. Pet parents who want lifelong health for their fur family and not just those quick fixes. They understand that investing in your own growth and education, having skin in the game, is the only way to truly grow and not stay stuck on the treadmill. So people who are action takers and are actually going to implement the information. So if this sounds like you're invited to set up an interview to see if our Better Gut Health program is the right fit for you. You'll actually be receiving an email in your inbox with a link where you can schedule an interview. I personally set aside time in the next 14 days to talk with you to see if this is the right fit. The call is approximately 45 minutes, and the intention is to understand where you're at with your pet's health and identify how and if we are a fit to work together inside our Better Gut Health program. It is a paid program, so that includes personal guidance from me, a hair tissue mineral analysis test that we've talked about during this webinar, and education. So you know how to fix your pet's gut health and achieve optimal health. So we're only taking a small group of pet parents for this 6-week intensive program. At this time, our next program will be starting in January. But you might be having some questions, right? And these are common questions that come up, like, what about, you've already tried a ton of different supplements, herbs, and diets. Don't worry, you are my clients. This is what I'm used to. And we have to take a step back, look at the bigger picture, that ecosystem, do some personalized testing, get a better idea where those imbalances are, what you've tried. That's the power of the personal consult side, doing some personalized testing, and then working intimately with you in the group setting during the weekly Q&As throughout the entire 6 weeks. So just because you've tried a lot of different things, they haven't been the right things, or maybe they were and you just didn't realize it, but you didn't see the results soon enough. So I am your guide to help guide you on the right path. And why is this any different from other things online? So we have other programs. What I like about this is being able to give you that personal consultation alongside the dedication and support over the 6 weeks with some personalized testing. Because I find one-off appointments are great, but you need the guidance and support. So when things come up, you can ask those questions and get guidance and support right away, rather than waiting weeks to hear back from your vet. We get better results this way. This is why I love programs. And 2, being a part of a community is amazing. a supportive, positive, empowering community where no question is wrong. It is a safe place. And also, two, other people are going through the same thing. So you're not alone anymore in trying to figure it out. And three, like, how do I know this is going to work for my pets? There's frameworks. There are principles we have to follow. Every pet is on a different path on their journey, and some have more serious health conditions. But when we strip the layers back and we dial in what we're doing, there's a path forward for even the pets that don't feel their best. This is something I went through with Finn, my soul pup German Shepherd, where there's nothing more you can do. Take it back to the principles and assess, why are we giving something? What can we tweak and adjust? Maybe there's some additional testing that hasn't been done. So I can't guarantee 100% results by the end of 6 weeks, but you will have the tools, the knowledge, and the ability to continue on the healing path even after the program is finished. And this is something too we can talk through during our discovery calls that you can schedule a call for to make sure it is a good fit for what you're looking for, because that's number one. Now, here's the bigger picture, right? Bringing it back home. A lot of times people can't see the forest for the trees. And I want to ask you, are the trees blocking your view from seeing the entire forest? So this is like staying stuck on that treadmill, not being able to see the bigger picture and only focusing on the symptoms. This is where that Better Gut Health program is your ticket off the treadmill and broadening your picture again, and finally fixing and figuring out what exactly is that root imbalance that has led to the symptoms that you're seeing in your pet. So this is a great overview of what you would be getting with our 6-week Better Gut Health program. You have lifetime access to the educational content that's released every single week based on different modules to help heal the gut. You'll receive those video contents, additional resources, guides, tools to help you. We do 6 weekly Q&As with myself each week. There's a private small community. Once again, this is a small group of pet parents, so that way I can give you amazing support, make sure you're taken care of. You get all your questions answered even between weekly Q&As. You also get 2 30-minute consultations with me, one at the beginning of the program, one at the end. We do a hair tissue mineral analysis test at the beginning to make sure that we are figuring out where are things off so we can better choose and adjust what supplements and foods that you're giving. And then any access to any content upgrades, updates, science changes, tests change. So you always have access to that educational content upgrades for life. So this is where you can schedule a call to learn more, see if you're a good fit, and find out, grab one of those slots. That will be starting that program in January. It'll be a great start for kicking off the new year, making sure that your pets are healthy, that you're doing everything that you can to make sure that they are doing well. So remember, your pet's health is an investment. It's not an expense. Sometimes it can feel really, really frustrating and feel slow, but this is something I always have to refer back to, especially when I look at my journey, I look at my husband's journey, our journey with our own pets, and even working with clients. There's always a reason why we would do a test. It's not just throwing different tests at you or different supplements. There is a framework that we follow to make sure that we are truly getting to why things are off, or how to optimize health for your healthy pets, which is very, very important. So here's what I know to be true. I would not be where I am today without investing and working with the people who were where I wanted to be. So once again, where do you want to be in 1 year with your fur family's health? So going back to that exercise at the very beginning, thinking about the emotions, the feelings that you had, where do you want to be? And this might be your fast path forward with support, education, a community, and guidance. So definitely schedule that call if you want to learn more, see if you're a good fit. And then you'll also be getting an email from us too. If for some reason you don't get an email from us, make sure you send an email to us at info@thenaturalpetdoctor.com, because there are some limited spots, or if you're finding all the slots are full, definitely send us an email and we'll make sure we'll take a look at our schedule and see where we can open things up. All right. Okay, that is everything. So I appreciate most of you staying till the end there. Let me open up our Q&A box, and then here we go. Let's answer some of these questions. First off, hands up Did you guys find that helpful, kind of reframing how we look at health, looking at the overall perspective, different areas that could be impacting your pet, creating those symptoms that you're seeing? Awesome. Okay, great. I'm seeing a majority of you guys raising your hands. That's fantastic. Thank you for sharing that. All right. Okay, let's go through this. Okay. I'm seeing a lot of animals with GI issues. Okay. Okay, so Tony, does pain meds mess up the gut? Yes, they do actually. And here's where, so non-steroidals are a common pain medication that are used with animals. Any medication can affect the gut when we think about it. And this is where, especially for pets that are on chronic medications, I see this too with like your acid blockers. So if you have a pet that has GERD or they vomit up bile if they don't eat soon enough, a lot of times your vet will say, oh, take a Pepcid or take a famotidine. Well, those are meant to be used short term. And I have a lot of clients that come to me and those pets are on it for years and years. And there's studies on the human side that show that it affects calcium absorption. So the other magnesium, it can affect zinc levels. And I see that on hair tissue tests. So there's a huge issue there. And we can't just take them off of things. We have to wean them. The other thing too, with pain medications, especially, quality of life is always the most important thing. I'm treating the pet, I'm not treating a symptom. And this is a big area, especially for like when we're treating cancer. A lot of times we just want to like kill the cancer, but we forget about the animal that's in front of us. And the goal is not for them to be feeling sick during that treatment. So with pain medications, if that pet is in a lot of pain and they're not feeling good, there is a time and a place. I am not against medications, but I also look at, well, what else are we doing to support? So if we know they need to be on a medication, okay, what else can we do? Let's make sure we're doing testing, that animal biome testing, to see, is the microbiome affected? And then maybe we use their fecal transplant capsules or do a fecal transplant enema with our vet if they do that. So you can keep on track of like how these pets are being affected by doing some of those additional tests that we talked about. And two, we know that non-steroidals can increase the risk of GI ulcerations like in the stomach, also create inflammation, increase the risk of leaky gut. So you could do an IPL test. That's another thing. Tony, you have a kitty. So unless you're talking about another pet, IPL actually has a 40% off discount through today that you could use. So Innovative Pet Lab, just FYI, randomly. So Cats Live 40 would be something that you could use. I will post it in the chat box for people. And you can get 40% off their test. This is where like looking for leaky gut or seeing if they are reacting to if you're feeding a kibble diet. Let me just quickly put that in there so you guys have this, because we did it with our own cats and it was so good. Code. So I just put that in there in the chat box for everyone if you wanted to use that. There are 2 tests from Innovative Pet Lab that you can order. It's a stool test, so really easy to do. You mail it in, you get a report. And then also Dr. Betsy, who we've done a lot of interviews with from them, also will interpret results. So I'd be looking at how can we better support them? Are we using natural remedies to help reduce inflammation, support pain? There's a lot of different things we can use to help them in terms of like physical health. Are there images for the names of what you just mentioned? I'm not sure, Sharina, what you're referring to. Great. Okay, so Anthena, that's great. So Innovative Pet Lab can't be used internationally. Animal Biome can, a lot of people, like Singapore is one of their biggest client areas. So you could always see there's more companies that are coming out. So I always recommend looking to see, are there other companies getting reviews, calling the company too, if you're not sure if they're, if they're a good company. That would be how I would approach, like for my overseas clients, because it is definitely can be a little bit harder, especially when you're dealing with stool. Here's the thing with the hair. This is also why I like hair tissue tests, because we can do those for pets anywhere. It's just essentially a tablespoon of fur, and we get an idea of what toxic metals are present, vitamin mineral imbalances, and looking at, your ratios to see what's adrenal stress, kidney stress, all of those things. So those, the hair tissue test, that's why we offer it for this program, because we have a lot of overseas clients. And then we work with you to figure out what foods you have access to. And then there's a lot of great ways that I look at to see what supplements you have available too. So that way you can access the recommendations that I have for you. All right. Nicole, I make my own raw, but I use grocery store meats. They aren't organic or free range meat. Is this still beneficial and healthy? 100%. Your less processed foods will always be better, even if you can't do organic or free range. Yes, organic and free range is like top notch, right? But I would much rather you be doing fresh foods than feeding a processed food diet, because those are going to have a lot more chemicals and toxins in them than your less processed fresh foods. So 100% Nicole, keep it up. That's awesome. Priscilla, I currently use NextGuard Spectra. What can I use instead for the prevention fleas, ticks, and heartworms? We actually have an entire bonus webinar on what you can use in the program, but we also have a free blog post on fleas and ticks and natural remedies that you can use instead. We also have a video on our YouTube channel. So you can go to the naturalpetdoctor.com, just type in like fleas for your search, or go to our YouTube channel, Dr. Katie Woodley, the Natural Pet Doctor. And there's a lot of great information there that you can access for different companies. So highly recommend checking that out and getting your pet off NextGuard, because I hate those drugs. I've seen pets die from them, seizures, behavior changes. And even if you've been using it, that next dose may be that threshold that's crossed and where we see symptoms. So I highly recommend getting them off of it, checking a microbiome test, seeing what's going on with gut health, also potentially looking at hair tissue mineral analysis to see what's the level of toxins. So that way we know how much do we truly need to go all in with detoxification, microbiome support, reducing inflammation. What can I use for dental health without using doggy toothpaste? I stopped toothpaste since I've been dealing with his GI issues. Super easy, simple solution here is coconut oil, and add in a good broad spectrum probiotic capsule. So Adored Beast is one where you can use love bugs, mix it in. Now you have a good probiotic paste, and just use that on the teeth with a toothbrush. So you won't create GI issues with that. You're also supporting a healthy microbiome. So that's a great, easy way that's cheap. Enid, we do hair tissue mineral analysis tests separately too. So if you're not part of the program, you can always do a hair tissue mineral analysis at any time. Like I said, whether you're overseas or not, doesn't matter. You can send hair from anywhere, and it doesn't have to be sent specially. You can send it normal mail, just FYI. Don't spend a fortune sending fur to us. We send it to the lab. They process it. I get the results. I create a report for you that's typically 7 to 10 pages long, give you nutritional recommendations and supplement recommendations. That's included with the 6-week Better Gut Health program. But if you wanted to do something maybe first, if you're worried about a larger investment for a program like this, you could always start there and get an idea of where your pet is at. That is at our website, so thenaturalpetdoctor.com, and you can go to our natural pet care shop, and you'll see the nutritional hair tissue mineral analysis test. If you can't find it, you have questions, just send an email to info@thenaturalpetdoctor.com. Carolyn, great question. I have 2 dogs. Do I need to purchase 2 programs? No, you don't. So if you wanted to do 2 hair tissue tests, we do an additional hair tissue test. So it's not the full cost that you would see on our website, but you can put both pets, through the program, you can ask questions on both pets. We have a lot of people that have multiple pets that have health issues, and they utilize the program for both pets because the frameworks, the principles are the same. And then being able to get guidance and support through the community and the weekly Q&As is really, really helpful. So you don't have to pay for 2 programs. So that's a great question. Nicole, what's the testing I should use to find out if my cats have leaky gut? This is a great question, but there's a bigger, this is going back to looking at the bigger ecosystem, right? So there's so many different factors that can play a part. So I'd be looking first at, are there things we need to remove or replace? They don't have chronic diarrhea or bad skin or anything like that. But if I try to add anything to their meals and they get diarrhea, so there's something there, something is irritated. So you could always start with the innovative pet lab tests, Nicole, if you wanted to. Otherwise, highly recommend the 6-week gut health program. So that way we can dial in deeper to some of these other factors that may be playing a part. And maybe if we need to optimize the diet or if there's a food sensitivity there. But your IPL tests are a good starting place. Animal biome are great starting places to go from there. Carrie, wondering your thoughts on using Feel Away for anxious kitties. Feel Away can work for a lot of cats. I know there's some people that are really against Feel Away. They worked well for our cats, especially when we introduced Moki into the household. I think they're worth trying. And if you don't like them, there's a lot of other great ways to support reducing anxiety for cats naturally. We've done webinars on them. You can check out our YouTube channel and just search anxiety or cats, and it'll come up with a lot of that. Allergy immunotherapy, once again, it goes back bigger picture. So why do we have allergies? What's going on? What's creating the symptoms? What are we feeding? What's the environment like? Those are all questions that I ask. I always ask why, not just like the treatment. Allergy immunotherapy can be very, very helpful for pets, especially if they're scratching themselves and they're creating sores and their quality of life is being impacted. I would rather use immunotherapy than say steroids. Your immunotherapy is desensitizing the immune system and helping them. So it can be very, very helpful for a lot of cats. B longum for anxiety, and if there's testing to know if a cat is lacking that bacteria. So the animal biome tests are very, very helpful for looking at the microbiome. B longum for anxiety does have, so Bifidobacterium longum is a strain. There's also, what is the company called? Big company created a probiotic, single strain probiotic. And I believe they also added an animal digest, which is trash and will create inflammation in the gut and is essentially a rendered product. If you don't know what rendering is, definitely at least get into our beginning 21-day gut health program if you're not ready for like an intensive program, but you need to know what rendering is if you're still feeding processed food. So that's definitely something worth doing. But the thing is if we're only using a single strain, we're kind of missing the bigger picture, because it's kind of like looking like missing the forest for the trees. So it can be helpful, but it needs to be part of a multimodal approach once again. So that's how I would look at that. And a lot of like the probiotics, prebiotics, it can differ depending on the cat and what's going on. Some pets can be really sensitive to probiotics, especially if we have an overgrowth of bacteria in the small intestine. So I can't give specifics on that. Sandra, great question. If in the process of the program you think there are tests that need to be made, will you let us know? 100%. So Sandra, what we do first, steps that we do. So let's say you decide this is a great fit, you enroll on our call. And then what happens is we do a hair tissue, we send you info for the hair tissue mineral analysis test because we want to get that as soon as possible. And then once we get that sample, it takes about 2 weeks for us to get that back. Then you actually set up a link for scheduling your first call. So our next program starts mid-January. So this gives us enough time to have those results. You fill out a nutritional questionnaire, give us a lot of detailed information. So I have an idea what's been going on. And then I create a plan for you. So if there's additional testing that we need to do, you can get that done prior or before the program even begins or at the start of the program. And then as test results come in, you can post them in the community. And then at the end of the program, what we do is we jump on another call to set you up with a long-term success plan. So that's how it works. So during those 6 weeks, we have our weekly Q&As. You have the community where you can tag me in posts and questions and get further guidance in between Q&As. Everything is recorded and time stamped to make it as easy as possible so that you get results as fast as possible. So I hope that helps. Okay. Another great question. Do I have to purchase 2 programs if I have 2 dogs? No, nope. You can use it for both. You can use it for all 19 cats if you have 19 cats. So principles, frameworks are the same. If there's health conditions going on, you can ask questions. So that's not a problem. So Haley, great question. Anal glands, allergies, eats blue buffalo, dog food. What would be the #1 supplement you'd recommend to add to support gut health? Get off blue buffalo dog food. So no supplement, get off blue buffalo. I am not a fan of that food. I used to, when I worked in a conventional vet practice, I used to, anytime I'd see a patient with diarrhea, I'd ask, do you feed blue buffalo? So if that gives you an idea. So Carolyn, is the program a specific day a week? So the program is released to you to work through as you can with your time. So it's released each week, each module, so it's not overwhelming and you have a path forward, but you just work through it on your own time. So there's the main webinar, additional resources. Some modules have additional bonus webinars, but you always have access to that information. And then we do a weekly Q&A each week. All right, let's see. Okay, Lori, I've used Darwin's, I'll provide Viva Raw, but I also use a local raw company that uses 80-10-10. What can I add to this to make it better balanced? Lori, we cover all of that in our program. So definitely if you're interested, because there's a lot of things that we can do to make those balanced and how to go about that. My dog, Sherry, my dog has serious IBD. Can dysbiosis be fixed or is it something we need to maintain? My dog has a veterinary nutrition and every other vet you can imagine. Yes, usually I'm a team of like 5 or 6 vets with a lot of my patients. And usually I see end stage diseases by the time people, especially if they weren't aware of holistic medicine, they find me. We can do a lot for gut health. So that testimonial from Kelly, her dog has protein losing enteropathy, which is the most serious form of IBD. So within 6 weeks, we saw results. Now, each pet is different. Each client is different. Each environment is different, but there is so much you can do. That's why I love like integrating in Chinese herbal therapy where we need to. I also do food therapy. So using food as medicine based on the energetics of your pet. And that is a part and a big part of the program too. So veterinary nutritionist is usually just relying on prescription foods, balance it, not really going into the energetics of the diet and using herbs because it's just not part of their training. So that's a big part of what I do for my patients and a big part of the 6-week program. So do you have, you have 2 Dutch Shepherd Terriers, American Staffies with bad ear problems. Once again, frameworks. It's not about what supplements can we use. We need to figure out what's irritating the immune system, what's going on in the gut health, what's creating that inflammation that's leading to the ear infections. The ear problems are secondary to something else going on. So there's not one supplement, there's not one holistic medicine. This is where this whole entire approach is really, really important to figuring out what's going on at the root cause. Otherwise, if we just use a natural ear cleaner, or say we use like Oregon grapefruit, or we use just one herbal medicine, but it's the diet, we've completely missed it. And that pet's going to stay, you're going to stay on that vicious treadmill and having the same problems over and over again. Okay. Let me see if there's other. Okay, so I'm getting a lot of like specific questions about health issues. So keep in mind, health issues, allergies, runny eyes, like indolent lip ulcers, upper respiratory infections. These are symptoms of an underlying imbalance. And this is everything that we go through in the program in depth, and then also to go through the personal consults. And this is also where those hair tissue tests can help identify where those imbalances are too, so we can get them on the right supplements. If I were to tell you to basically use like a CBD or something like that, I'd be doing you an injustice, because that's essentially using holistic medicine like conventional medicine to potentially treat a symptom. So Enid, you can do a hair tissue test on all 6 cats. We just got, I think, 3 samples from someone recently. So you can, it's just a first sample. How we do the hair analysis is you definitely either cut or shave the hair. You don't want to pull it out. That'd be really stressful for the animal. So if you have shavers, that's the easiest way. If you're cutting the hair, you just have to get as close to the skin. So if you're using scissors, just be very careful you don't cut the skin. But we want to get as close to the hair follicle as possible. So that'll give us the best results. And then you just, a tablespoon of fur, you mail it into us, and then we send it to the lab. Priscilla, your IPL tests, they will be able to, your vet probably won't know how to interpret it. So you'd want to take that. I believe Dr. Betsy is doing recommendations with those reports, who works with IPL. So she'll have a better idea what those tests actually mean. If you decide our program's a good fit, I go through those test results with you too. So I have you post those because a lot of people do those in the program. Perfect. And Carolyn, you should have gotten an email with a link. If you did not get the email, it should have gone out about an hour after. If you don't see an email, definitely send us an email at info@thenaturalpetdoctor.com, just letting us know you want to sign up for an interview. Okay, perfect. Angela, I'm not sure what you mean. I already have animal biome result today. I already sent an innovative, comprehensive, waiting for results. Why would I spend money if I've already done the test? I'm confused. I'm not sure what you mean. If you're referring to the program, then it would be the program is going to give you how to fix the results that you're going to be getting. But I'm not sure exactly what you mean. And then Lori, the program, yes. Will we be offering this program? Again, hard for me to do in the next month or so. Yes, we will be. So small group of pet parents, we take them through this. We will also be offering this throughout the year. We've done a few rounds of the program already, which is why I have faith that you can get results when you put in the work and you show up, right? So that's a big part of it. But I also understand end of year for people. If you want to do a hair tissue test just to get the ball rolling with things, you could always do that at any time too. So definitely reach out to us. We have other programs also, but our Better Gut Health program is one that includes personal consults and also to the hair tissue test results to dive deeper and see where are things off. All right, we're gonna round it out right there. I appreciate all of you showing up, taking time out of, once again, your beautiful evening to learn a little bit more, ask questions, want the best for your pets. You are truly my people. I love all of you, and I mean that from the bottom of my heart. If you haven't gotten an email with the link to schedule an interview or discovery call to learn a little bit more to see if you're a good fit for our Better Gut Health program, once again, you can always send an email. That email is there, info@thenaturalpetdoctor.com, but just make sure you check your spam first, or it may take us a little time to get through those emails to get back to you. But I look forward to talking to probably a few of you and hopefully being your mentor and your guide on this journey to making sure that we're doing everything possible to truly heal that root and balance for your pets. All right, everyone, if you're not already following me at The Natural Pet Doctor, go to Facebook, Instagram, follow us on YouTube, and make sure you check out our weekly newsletters. All right, take care, everyone. Bye.